Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.in and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary. For the medical knowledge to general people and for reference to medicals. Today I am going to discuss about the urethral calculus and neoplasms of male urethra. Sometimes urethral calculus can form behind a stricture or in an infected urethral diverticulum. Calculus, which has migrated from the ureter, becomes arrested in the prostatic bulbous or penile urethra. Clinical features preceded by renal colic, sometimes before. Patient experiences sudden pain during maturation and the stream ceases suddenly. A few drops of blood stained urine occurs and may be followed by retention. A stone is palpated from the floor of the urethra. Dysuria may be present. Treatment: prostatic urethra. When the stone is arrested, the prostatic urethra under general anesthesia, a metal bogey is inserted along the urethra till the calculus. In case the recent impaction, the stone can be pushed into the bladder. Here it can be crushed by lithoepoxy and the fragments are evacuated. If the stone is long-standing one, the stone is hourglass shaped and impacted firmly, so it is approached through the bladder. Membranous and bulbous urethra. Sometimes a small stone can be removed by urethral forceps passed through the urethroskop. Urethroskopy is an alternative. A stone impacted in proximal urethra may be manipulated forward if the urethra is distended with lotion. The other method is to pass a number of filiform bogies beyond the stone, twisted them and endeavor to dislodge the calculus by pulling all the bogies out together. A stone in the fossa navicularis are manipulated into this position. Sometimes can be removed by urethral forceps or by inserting a probe behind it. Operative measures. In case of bulbar and membranous urethra, myotomy is required to permit the stone to be withdrawn. An incision is made through the floor of the urethra onto the stone. External urethrotomy. After the stone has been extracted, in absence of a stricture and gross infection, the urethra can be closed in layers. Neoplasms of male urethra. There are some types: polypi, papilloma, angioma and carcinoma. Polypi. These are multiple, occur in the region of virumnatum. Seen in urethroskopy, each polyp is a finger-like projection with blood vessels coursing over it. Polypi are found with chronic infection. By clear of infection, polypi disappears. If polypi are removed, the infection responds to treatment well. It is classified as granuloma. Papilloma. A solitary papilloma occurs within the fossa navicularis and as it enlarges protrudes from the external urinary meatus. Multiple papillomas associated with penile papillomas sometimes spring from mucous membrane just within the external urinary meatus. Papillomatosis of the urethra is most often associated with papillomas of the bladder. The posterior urethra is considerably affected than the anterior urethra. Symptoms: slight hematuria before maturation. Angioma. It is a rare form. There is hematuria which is profuse and may occur independent of maturation. Treatment. Diathermy coagulation through the urethroskop. Exceptionally, the neoplasm is so accessible that it can be fulgurated without employing an urethroskop. Carcinoma. It is rare. Urethral antecedent to carcinoma. Sometimes spread to inguinal nodes may occur. Cavernous tissue of penis is implicated. Distant blood-borne metastasis may be common. Clinical features. Profuse urethral discharge, blood-stained urethral discharge, symptoms of stricture supervene. The chronic nature of the condition in man beyond 40, blood in the discharge or urine, tendency to bleed during instrumentation, palpable induration or factors that lead to suspicion of carcinoma. In deeper parts of urethra may be purpureal abscess after incision fails to heal, and periurethral induration increases. Biopsy confirms the diagnosis. Treatment. If the growth is in the anterior part of the penile urethra, partial amputation of the penis can be carried out. And provided the growth has been diagnosed reasonably early, long survival can be expected. Complete amputation with the construction of a perineal meatus is required when the neoplasm is situated more posteriorly. When the carcinoma is situated further back, a still more extensive operation, which includes a radical prostatectomy, is the only hope eradicating the disease. That's all about the urethral calculus and neoplasms of the male urethra. And in the next